Good afternoon, everyone. My name is Devin Swanson. I am the copywriter at Healthcare Services Group. Welcome to our Fireside Chat series. During the month of April, HCSG is highlighting infection prevention and control. Today, we have gathered a few key company leaders to discuss the elements that make up an effective and successful infection prevention and control program. So let's get started by letting our leaders introduce themselves. Jeanne, we'll begin with you.
Thanks, Devin. My name is Jeanne Fissinger. I am Senior Vice President of Policy and Training Development. I've been with Healthcare Services Group for 10 years, and my job is to ensure regulatory compliance with state and federal requirements across the 48 states in which we operate. I also work with operators and Steve and others in the field to develop policies and easy to understand interactive training that's in line with the various agencies, whether it's CMS, the CDC, the DOL, FDA, and OSHA, and their related state agencies and their regulations.
My name is Steve Schweon. I'm a registered nurse by education, and my title is the HCSG Corporate Infection Preventionist. And I've been with HCSG for 9 months, but with the pandemic ensuing, it feels more like 9 years. And my primary responsibility is to collaborate with our HCSG teams and clients to create, monitor, and sustain our infection prevention strategies, especially during this pandemic, to keep our employees and clients safe.
My name is Jared Norris, and I've been with the organization since 2004. Like many of our leaders within the company, I started as an MIT and worked my way through, I think, about every single operational capacity, ultimately culminating in my current position, which is VP of Operations and Analytics, which is largely the largest focus of that role is really a kind of strategy development and implementation for the operational leadership, which puts me in a position where I am fortunate enough to interact with individuals like Jeanne, like Steve, like Mr. Merzwa on a daily basis. So.
Hi, everybody. Greg Merzwa. Coming up on 16 years this summer with the organization. I serve in a role of the senior director of operations on the EVS side, currently dabbling in dining and nutritional services as we expand the organization in that segment. Primary focus is going to be operational excellence and customer success. Thanks for having me.
All right. Well, thank you all for taking the time to introduce yourselves. So as we begin our discussion, it is a bit difficult to discuss an effective infection prevention and control program without stating the obvious of what has been going on in our industry for the past year or so. Even now, it's really difficult to watch or read any news without seeing the extreme impact COVID-19 has had on the long-term care communities. And this brings me to my first question for us to discuss, which is, why were nursing homes so heavily impacted the way that they were at the start of the pandemic?
Well, this is Steve, and I will start with that. We know that nursing home residents live in a community, and in many aspects, it's their home. They may socialize very closely with each other, with staff, with friends, and of course, their families. And as we get older, we start to develop, in some situations, underlying medical conditions that makes us more susceptible to infection as well as other diseases. Now, you couple this with ventilation issues in some nursing homes where the air supply may not be optimal and the air may become stagnant. And one other factor which we know now that we did not know when the pandemic first started was you could be asymptomatic, meaning feeling fine, having no signs or symptoms of COVID, and still very effectively transmit this virus to the residents and other people as well. It's a combination of all these things that have propelled COVID into the nursing homes.
Right. There's a lot to take in, and it was definitely, especially with those really at-risk communities, I'm sure there was a lot of panic going on in those initial days. And Jeanne, as you mentioned in your introduction, you oversee the significant training that our employees receive out in the field. I have to assume you and your team were doing a lot of reading and research as things were developing by the minute.
That's right, Devin. We started preparing even before COVID hit the long-term care communities. we, and I mean Jared, Steve, myself, Greg, everyone, do a lot of reading and scanning research from various agencies, whether it's CDC or CMS, the Environmental Protection Agency, EPA, or OSHA. And we read medical journals. And I happened to see an article in a medical journal back in February of 2020 about COVID-19. And that's kind of when I started to look at this and said, this is looks like it may transmit sort of like the flu. And so we need to start zeroing in and paying some attention here. And that's really what we did. And I think we stayed in communication, and everybody out in the field would communicate to us when there was something that needed to be dealt with or looked into. And that's how we stayed on top of things.
There you go. So definitely the preparation starts with preparedness.
Yep.
And since Healthcare Services Group, we do serve over 3,500 communities across the country, providing environmental, dining, and registered dietitian services. So I would imagine that during those first few weeks, our client communities were probably trying their best to take control of the situation.
Yeah, Devin, I'll jump in there. You're 100% right. The long-term care community, as we knew it, essentially shut down in the beginning. They canceled visitations from any outside family members, including Healthcare Services Group, district managers, DOs, and above to the facilities. They eliminated communal gatherings in the day rooms or dining services in the dining rooms, even to physical therapy. There was also a huge emphasis on PPE and sourcing it. How much do they need? Where are they going to get it? Things along that lines. And then kind of when they started to get our hands wrapped around it, you get into the resident cohorting. Kind of like a red, yellow, green sort of thing. Green COVID, green COVID negative, yellow under suspicion, and then you unfortunately have the green where the red where they are COVID positive. So huge change in our communities and turned us upside down.
Definitely, and changes by the minute, especially in the beginning. And, I think this is a great way to transition and discuss specifically what Healthcare Services Group did as a company to ensure that our frontline staff was armed to be able to handle this fluid, changing by the minute situation.
Yeah, Devin, we had to quickly update our training or create new training as the CDC continually rolled out new requirements, especially in the beginning. Now they seem to be more fine-tuning what they already had put out. However, I can't emphasize enough how much communication was the key and is the key. As the COVID situation continues to develop, myself and Steve and Jared, et cetera, review and update our policies and procedures as needed, and we communicate any changes via email, as well as posting any updates on our company intranet, the hub. Additionally, as the requirements change, the training team, with the help of our operators, creates those new courses we need to address this, and we deliver those to our employees through our learning management system.
Yeah, and I mean, to hop in and kind of build upon what Jeanne said, from the operational capacity. I mean, effectively, we were fortunate in that we were a bit ahead of the curve because we knew what was coming down the pike. However, Jeanne made mention of the interrelatedness or the communication between the corporate office and the field. And while I think you did a great job exemplifying that, to kind of take it a little bit further, I mean, it was rapid fire back and forth between, the highest levels of leadership at the corporate office. I mean, to, DMs and DOs who were really informing us of the situation on the ground, and we were able to adapt very quickly. I mean, I think if Jeanne, myself, Steve, and even Greg were to look back at our emails from, March through April through June, and I mean, it was just a seemingly endless volley of updates based on the information that we were getting back. And that's where, that connectivity or that interrelatedness of all levels of leadership, I think really is the biggest testimony to how well we were able to navigate that pandemic. Likewise, out of this disaster, this pandemic, we did successfully kind of upgrade and integrate our information platforms. Jeanne made mention of the hub. I mean, in a very short amount of time, we had our entire COVID binder loaded onto the hub. We had it readily accessible to all levels of leadership that was being updated on a daily basis. And then we were able, through that platform, to reach the widest possible, tapestry of end users to really impact the operations at the facility level and make sure that our teams were well informed and well armed to deal with this pandemic.
Yeah, and Jared, you made you made mention to kind of the boots on the ground and the operators on the field. I think it's super important to note that, we already had a pretty complex and well-written infection control policy and practices prior to the pandemic. So, to use a kind of sports terminology, is we were practicing for the big game already. We were kind of ready for Sunday football. So I think that was important. That's important to note and acknowledge as well.
Well, and I think you raise a good point on that, Greg, because we had the baseline of a great infection control program already laid out, right? We also had well-established nationwide relationships with a lot of our vendors, which thereby in turn allowed us to really be able to procure the personal protective equipment to keep our staff safe in a time where the majority of the healthcare population was struggling mightily to get those goods. So we were able to make sure our staff was safe and had the proper equipment along with the proper training to really combat this. And so much so really that a lot of our policy or even our ability to procure PPE was adopted by a lot of our customers. We were able to really kind of lean forward and help out in a time where they were unable to get those things for themselves. So again, hats off to the operational team for communicating the need from the field, and hats off to our purchasing department for being able to kind of come through and really provide those goods in a time where it was drastically needed. So
Yeah, and I think you all have hit home the point, mentioning how EVS and infection prevention control is what HCSG has been doing on a daily basis for the past 4 decades. So it is what that's kind of our bread and butter as a company. So, and I think Steve and Greg, you can probably share with us, what are those components of a successful infection prevention and control program? And did any of those components have to change because of what we experienced in the past year?
There are several, actually numerous components of a very successful infection prevention program, and let me quickly outline them. The first is the priority to keep our employees and our clients safe. That's priority number 1 for us. We use evidence-based best practices, as Jeanne mentioned, just to ensure our policies and procedures are aligned with the CDC, CMS, and other governmental type agencies. When there is no evidence-based best practices available, which happens a lot, we review the literature and we put our heads together to try to figure out what is the best practice, what is the best policy that we can implement to meet the goal and to keep people safe at the same time. As Jeanne mentioned, we offer a very robust learning platform, and we offer infection prevention education throughout the year and not just on an annual basis. And what that means is we keep infection prevention up front for our employees throughout 12 months and not once a year when they're trying to meet their annual education requirements that we sometimes see with other organizations. We provide competencies to ensure that our team is doing the job correctly. And 2 great examples would be hand hygiene, ensure that they correctly sanitized their hands, as well as applying and removing personal protective equipment, also known as PPE. We perform virtual rounds where we partner with our client and we go into the facility and we assess housekeeping, laundry, dietary, and nursing practices, just to ensure that they are adhering to policy, to ensure everything is safe. And we offer just-in-time education and coaching as needed. Now, we also take a broad spectrum approach to cleaning and disinfection. And what I mean by that is we just don't focus on COVID, but Greg did a good job mentioning that we talk about all the emerging threats that are out there every single day, the other potential germs and pathogens, whether it's multi-drug resistant organisms such as MRSA, neurovirus, the respiratory viruses that are out there, such as the flu, cold viruses, RSV. We are prepared for Ebola. We are prepared for bioterrorism. Our processes and our disinfectants can effectively eradicate these pathogens and other emerging pathogens that may be coming down the pike. One final thing that I would like to add is our team has had personal experiences with nursing homes. We've had family members in nursing homes, and both from a personal and professional perspective, we are extremely passionate with what we do to ensure a pristine environment for everybody. Thank you.
Yeah, Steve, I think you nail it on all fronts there. But again, going back to the boots on the ground, everything that Steve, Jeanne, and team put together, when it comes down to the nursing homes at that level, it's just that daily training, ongoing training, teachable moments, keeping morale up, surrounding the training, and what have you. Just daily emphasis, daily teachable moments.
Yeah, and to build on, I think what Steve and Greg have both said, I think we've continued to evolve, right? We're acting as educators. We make sure that we have the right tools and the right products to have the highest degree of success in our centers. And likewise, I think throughout COVID, and hopefully beyond, we've strove to I guess be at the forefront of adapting new infection control procedures. We saw that a bit with the electrostatic spray program. Jeanne, Steve, myself worked through that quite a bit, and saw a lot of good returns from that rollout of that program in Q3 and Q4 of last year, and a continuation of it. Steve made mention of our desire to have the most effective chemicals readily available that will combat all emerging pathogens, not just COVID. Despite the impact of COVID on the long-term care community, it is one of the easier pathogens to kill. But Steve and myself and Jeanne have really made a concentrated effort to make sure that our staff is educated well in regards to contact times and chemical efficacy kind of for all pathogens, not just COVID.
Definitely. And I think that helps hit the point home that, infection prevention is everyone's responsibility. And that is what this pandemic has shown us. I think back on how I clean my own home, and I have to admit, I'm paying a lot more attention to those light switches, those doorknobs, wherever people are touching, and perhaps doing a lot more disinfecting than I did prior, so that I can ensure that my home is as germ-free as possible. So would it be correct to assume that this could be the case now at the facility level?
I'll take the first swing at that one. I think, yeah, Devin, I would readily agree with that. Particularly through COVID, obviously, the emphasis upon high touch surface cleaning. We were disinfecting surfaces more frequently throughout the day, especially in the high touch areas, than we ever had before. As we're seeing the vaccinations permeate the facilities more thoroughly. Do I think that there's going to be less of a focus on infection control and disinfection? No, I don't. I think we're going to see a continued emphasis on those things, because I think we've learned something as an industry throughout this. I think our environmental services leaders at every level are more likely than not going to be kind of staring down the barrel of a more intense regulatory environment than they've ever dealt with before. Now, as a result, and I guess a positive outcome of everything that's occurred in the last year, I think that through everything that we've done as an organization, our environmental services leaders are very well positioned to be successful and to stand up to this increased scrutiny. And likewise, as an organization, we've made some very assertive moves in regards to standardizing our disinfectants being used, standardizing our policies and our procedures. Through a lot of operational involvement throughout the entirety of the pandemic, we were really able to kind of winnow down our chemical platforms that we were using to a much less to a chemical catalog that has a lot less variables than it ever did before. So if we're using a more standardized approach on that, we're going to improve staff understanding. We're going to improve staff's ability to correctly answer surveys when they're asked what chemicals are being used and what the dwell times are. So I think, again, we've been able to adapt and overcome very well throughout this process. So I do think we are well positioned for the next stage of infection prevention at the facility level.
Yeah, and it definitely seems like things were all hands on deck for our teams, both on the ground and those supporting our employees in the field and corporate. And this made communication an essential aspect of how we operated in the past year. So speaking of communication, have we found instances where client communities were reaching out to us for assistance in staying up to date on new regulations and requirements as they were rolled out?
I'll take that one. Yes, several clients have discussed regulatory requirements with us, and we're interested in how we ensured our training meets the regulations, part of which includes having documentation of the training for each employee. Each year, we review and update our interactive training videos as needed to ensure that they're compliant with federal and state regulations. We then utilize the learning management system to deliver that training to our employees and to produce documentation in the form of reports and certificates. The certificates can be kept in the employee's personnel file, while the reports can be kept in a binder to show to a surveyor when they ask for proof. Additionally, we have competency checklists and quizzes that we use. We have a return demonstration checklist for various topics. I think Steve mentioned hand hygiene to ensure the employee can perform that in a correct manner.
Well, in preparation for our discussion today, we asked viewers to submit questions, and I'd like to review a few of those with you all today. So our first question is, how can HCSG as an organization in the healthcare industry help combat negative public perceptions of long-term care living following the fear that this pandemic has caused? So for example, a lot of people out there are probably looking to put their mom or their grandparents in nursing homes, but are hesitant, like asking the question, will my parents be safe in these settings?
Great question, Devin. And this one, excuse me, this one hits home for me specifically, just because, well, for all of us, but just recently having many conversations with family, friends, and neighbors because they know the business I'm in. And I kind of dwindle it down to really, we shut down the community in general for the first 2 or 3 months. I mean, that speaks volumes itself. But, there was a point where none of us, including everyday, Joe out there, had no idea what to do with this virus. Through that time, through Jeanne, Jared, Steve's leadership, we've figured out how to wrap our hands around it. And today, I would tell them that our nursing homes are safer than your local grocery store. Bring mom and dad in, bring the grandparents in. Where our communities are as safe as anywhere, if not safer.
Yeah, to kind of build upon what Greg said, just from a kind of organizational standpoint. I mean, I think it goes without saying that our staff members at the facility level, housekeeping staff, laundry staff, floor care specialists. I mean, these are people who have been dedicated to the providing of a clean and sanitary living environment for our patients, since before COVID. And I think it stands as a testimony that they all worked around the clock throughout the entirety of this pandemic. And I think, taking that even further, these are folks that are absolutely dedicated to their jobs and absolutely dedicated to providing that environment for the patients at these facilities. So I think by learning the lessons that we did through COVID and really continuing to adapt and overcome and provide all of the great training and the enhanced chemical lines, I think, to Greg's point, at this stage of the game, our facilities are very likely cleaner than in most of the places you go day in and day out. So.
I mean,
That's
for me, as
awesome.
I think about the question, I know that our evidence-based policies and procedures, our disinfectants, our equipment such as the electrostatic sprayers, in addition to our industry partnerships, our collaboration with public health partners, clearly has us well prepared to offer a pristine environment to the nursing home community.
Oh, that's great. I mean, especially as someone who has a Nana who is considering long-term living, it's really reassuring to know that you guys are at the forefront, along with our field employees, at the forefront of this and making sure everyone's staying safe. So that brings us to our second question, which is, should we anticipate more changes to regulations from CMS, the CDC, et cetera?
That's a good question, Devin. And I think since CMS overhauled the regulations and required a 3-year implementation period that started back in 2019, I don't believe we'll see many changes to the current federal regulations themselves. However, what we may see is more state regulation and various interpretations of the state and federal regulations, like what does it look like in practice? A lot of our surveyors are nurses. They're not environmental service specialists. They're not dining specialists. So there's some question there in what practice looks like. And that obviously varies from state to state as well. It's not surprising that all of this is a bit confusing for people because the regulatory landscape is really a web of various agencies, whether they're state or federal, who define what's required in various topical areas. And by that, I mean, for example, we have to look to OSHA when we want to know about respirator use. We have to look to the CDC when we want to talk about disinfection, to the FDA or Food and Drug Administration when we want to talk about proper handling of food, and to CMS when we want to talk about the overall nursing home regulations. And then you have their state counterparts on top of that. So it is a little bit confusing, and I can see where people would be overwhelmed by all of these various state agencies telling them you need to do this, you need to do that. And then what our job is, and I think that with the help of the operations out in the field, you know, obviously like Greg, Jared, Steve, we can pull all that together and synthesize it into something that our employees can understand, rather than saying, you know, quoting code sections out of either the federal or state regulations.
Definitely. Just listening to you list all of those different organizations off, I feel my head spinning a little bit. So I'm glad
Well,
that
there's
we
more
have
than
you
what I've
experts
said.
here.
It really, it's a challenge. It's a challenge, and especially when you get to the state level. But really, most states follow the federal regulations. So really, we're in darn good shape, I would say, as an organization, and we're lucky because we have feelers out across the country. We have people out in 48 states feeding back. It's like this continuous feedback loop of information that's just been wonderful. And I want to thank everybody that's helped me with that. That's for sure.
It's definitely a team effort here at HCSG. So that brings me to our third and final question, and that is, how as an industry will we have to change in order to combat COVID and other potential viruses and pandemics that might be on the horizon?
Well, in my view, I really don't think we need to change as an organization. We've been proactive, we've been resilient, we've been robust for years when facing these emerging infectious disease threats, such as COVID, such as drug-resistant tuberculosis, bird flu, swine flu, Ebola, MRSA, bioterrorism, et cetera. We are a very robust company. We are very evidence-based, and we're ready. I mean, Jared did a nice job summarizing how prepared we are every day. The bacteria and the emerging pathogens don't stop at 5 p.m. on Fridays. We are extremely well prepared. I feel very confident that I can call anybody on our team any time of the day or night, and I will quickly receive a "How can I help you, Steve?" response.
That's awesome. It's great to hear that we can be a resource both internally and externally to our client partners. And it's been great being able to chat about the actions that we took as a company this past year. So as we close our conversation, I would like to get your thoughts on the future, both at HCSG, in our industry, and even the country as a whole in respect to infection prevention and control.
Well, as you're asking me the question, as we're doing this recording, we're seeing a lessening of restrictions, and we also are being faced with a fourth wave of infectious COVID activity. And for us, we need to continue to be vigilant, to use the utmost caution, and maintain our safeguard practices to mitigate the risk and to provide safety and comfort to both our clients as well as our staff.
Thanks, Devin. My viewpoint would be with respect to infection prevention for all three, whether it's HCSG, the industry, and the country. I see a continued increase in subject matter expertise, communication and collaboration with operators. I think that's key, clients and federal and state agencies, which will lead us to trust and corresponding actions that are proportional to the facts of each new challenge we're presented with, whether as a company, as an industry, or as the country.
Yeah, and short and sweet for me, Devin. I think it'll be challenging, but I think our future with healthcare in the organization and our communities is bright. I think if anybody were to look at or watch this video, it's evident, it's proof that we're ready. We have the people, we have the systems, we have the policies, we have the procedures. I would say let the long-term communities focus on what's best, and that's caring for mom and dad, and let HCSG do the rest.
No, I think that's. Go
ahead, Jared. I'm sorry.
No, I was just going to say I think you guys have each said it very, very well. I mean, the interrelatedness between all levels of leadership, all departments of HCSG has just been nothing short but amazing to behold. Historically as an organization, we've proven time and again that we are absolutely at our best when everything's at its worst, right? I mean, whether it be hurricanes, fires, floods, we've not dealt with famine yet, but, we've dealt with a pandemic. But we have always been, we've been the linchpin, right? We're the guys that get it done when no one else can. And I think it is incredibly important that we take a moment and we realize that, we've done that very well historically, but it's always been short term. We've done this now through COVID for going on a year. So that means that it can be done going on forever. I think we would be incredibly foolish as an organization if we did not learn that lesson, that we are mighty when we are all working together, and the ebb and flow of communication and information is rapid and meaningful. I think we can make very well-informed decisions, and I think we can make organizational change at a pace that maybe we didn't think we could do before. So that, to me, would be the things that HCSG can take away. And I think by that token, to Greg's point, that's how we help to impact the industry on a whole. So.
I agree, this virus is not going away anytime soon. And we continue to be very grateful to all our employees who come to work every single day to ensure a safe environment for the residents, for our staff, and for their family members, and for everybody. So we're very appreciative of our staff.
Couldn't do it without them, Steve.
Correct.
Definitely.
Very appreciative.
I think that's a great place for us to end this conversation. So thank you all so much for your insight. The future is definitely going to look different, and a new normal is being created as we speak, but infection prevention and control will remain just as important as ever. So it's been a great time chatting with all of you. Thank you all so much for your time and your perspectives. I'd like to remind everyone that's watching that if you have a question for any of our panelists, you can still enter it in the submission form below our video, and we will do our best to respond to each. So thank you, Jeannie, Steve, Jared, and Greg. I'm Devin Swanson, and I will see you soon for our next Fireside Chat.